Hello, and welcome to Radiance Revealed, the podcast. I'm your host, Dr. Jen Haley. I'm a board-certified dermatologist, fitness enthusiast, nutrition expert, and global explorer that over the years has uncovered that your skin is a true representation of your internal health. Each week, we will chat with leading health, wellness, and even spiritual experts who will reveal secrets to true health and vitality. My goal is to help you change small habits to give you the power to create a more balanced, aligned, and elevated version of yourself. Now let's dive in. Hi, everyone. Welcome to this week's episode of the Radiance Revealed podcast. And I'm your host, Dr. Jen Haley. And with me, I have my dear friend, Swati Kannan. She is an assistant professor at UCSD and a cosmetic dermatologist. Welcome to the show.
Thank you so much, Jen, for having me. I'm so excited to be here.
Me too. Me too. So I have a rule I've always had since I've been a doctor that if someone could do a better job, I send the patient to them. And that's why I have you on the show today, because I want to talk about aesthetic treatments. And you are one of my top favorite aesthetic dermatologists.
Oh my gosh, I'm so flattered. Thank you.
Yes. So you're one of the top probably 3 or 4 that I go to. So I wanted to, because you're young in your career, but you're extremely knowledgeable and you're on the cutting edge. So when I thought about 2024 and discussing top 3 aesthetic technologies that you're super excited about being in the space that you're in San Diego, you were the one I wanted to reach out to. So thank you for being here, and let's get started with that.
Sounds great. No, thank you so much for having me. I feel so flattered. So I think 2024 is going to have a lot of different changes compared to what we've seen in the past. I think that one of the biggest things I'm noticing in my practice already is that people are moving towards tightening treatments and less towards filler. I think for the last 20 years, we've focused on just putting hyaluronic acid filler in patients' faces to help lift and to help tighten and to volumize, but now we're moving away from it. So one of the newest devices that we've had now for about a year or so is called Ellacor. And I know we heard all about it last year at the Masters of Aesthetics, but it's a microcoring device. And what that means is that it uses these tiny hollow needles to remove tissue from the lower face and neck, and it causes tissue tightening. The cores of tissue we remove are about 0.5 millimeters or less. So you can imagine like tiny little punch biopsies. And then that causes tightening without leaving any scarring. So that is the whole premise of Ellacor. And we describe it as the closest thing to a facelift without surgery.
Right. So it appears to be like a diffuse kind of facelift. So instead of just removing skin from the periphery of the face and pulling it back, you're almost, when I see the procedure, it looks like you're aerating the lawn, where you're pulling out these little plugs of tissue throughout the skin, and then that tissue can close on itself without really forming a big scar, and it tightens in the process.
That is an excellent, that's a great analogy. So exactly. So when we think of the typical facelifts, they kind of do a deep plane or superficial plane where they're just kind of cutting and pulling it back. But those facelifts can't really address, for example, the wrinkles around the mouth or the cobblestoning texture, or even some of the fine lines, right? Because it's just causing tightening of the jawline, mainly when you do a facelift. The nice thing about Ellacor is that you can get, the tightening isn't like a facelift, but you can get some tightening, but then you also get softening and improvement of the lines around the mouth, the cobblestoning texture of the chin. And those are so difficult to treat in general anyway. So Ellacor, just for the perioral area, like the smoker's lines around the mouth, it has completely changed like what I do in my practice.
Okay. So perioral is around the mouth.
Like
we're talking, we're kissing, we're chewing all day long. And, the movement of those muscles, as the collagen deteriorates, the skin doesn't bounce back as quickly. So even if you're not a smoker, the lines sometimes will stay there, after years and years of being alive. So, okay, who's the ideal patient for this Ellacor treatment? And then can you walk us through the treatment? Like, who's a good ideal patient? Who's not an ideal patient?
So the best patients are skin types 1, 2, 3. And so those are the lighter skin patients. So anyone that's my color or darker, I would not treat yet because we don't have enough evidence to see how much discoloration they can get. So anyone that's a lighter skin type, I don't have age ranges specifically because we all age differently regardless of our age. But anyone from like soft wrinkles, so just when you're starting to see the folds, all the way to the more severe wrinkles. Of course, the more wrinkles you have, the more number of treatments you need, and I'll kind of get to that in a second. Patients that are not good candidates are basically somebody that looks like me or darker, and that's because we haven't studied it. And anyone who doesn't really have a defined fold. So if you have a lot of heaviness and fat, Alacor is not going to work for you. You need more like liposuction and then tightening afterwards. If it's very fatty down here, Alacor won't work. If you have, if you have a tight jawline, but you have what's called the banding of the platysma, where we see the turkey neck, Alacor won't work for that because the reason you have the banding is because of the muscle issue, not the skin issue. So Alacor is good for collagen production. So anyone that has severe wrinkles caused by collagen deficiency would benefit from Alacor.
What about someone who's lost a significant amount of weight? Because I find those patients to be the most difficult over the years. Like tightening lasers are really unsatisfactory and time only improves so much. And we're seeing a lot of that with Ozempic face. Do you think those patients that maybe don't have a lot of fat under the chin, like you just mentioned, would they benefit, assuming their weight is stable?
I think they would need more treatments. And the
Okay.
reason is not only do you need the ability to produce good collagen, so you need slightly thicker skin. And what I have found is that patients who have incredibly thin skin, while they do respond to Alacor and some respond really nicely, the results are still quite variable. And patients who tend to have thicker skin with the ability to produce more collagen respond better to Alacor than patients who have very thin, incredibly lax skin, which is what I envision from, fast weight loss or the Ozempic phase.
Interesting. Okay. So I just want to go back to the darker skin types just so people understand. So we've talked about post-inflammatory hyperpigmentation on this podcast before. So is that the concern that we're seeing with this? So just to recap for anyone who hasn't listened to previous episodes, basically anytime there's inflammation in the skin, and I'm half Spanish, so even though my skin is fair, I have this tendency of my skin. So I completely get it. So when there's inflammation, whether you have a pimple or a cut or any sort of trauma to the skin, all of the melanocytes, our pigment cells, think there's a party going on and they go run off to the site and they leave a dark spot. So in a procedure where we might want to get some benefits to wrinkles, sometimes we're left with a brown spot. Is that what you're concerned about?
So that is a great explanation. I'm worried about post-inflammatory hyperpigmentation, but I'm also worried about post-inflammatory hypopigmentation. So
Mm.
when you get that whitening of the skin that some darker skin types can get, even if patients have a little bit of Spanish or Asian in their skin type, I still do Alacor and I pre-treat those patients with hydroquinone, which is a lightening agent. And I feel like it really decreases the risk of the discoloration. However, with the darker skin types, because I'm also worried about hypopigmentation, which is much harder to camouflage and prevent, that's one of the reasons we haven't tried it. I suspect, though, that if they did get hypopigmentation, it would go away, right? Because most of even the laser-induced hypopigmentation tends to go away. But we just haven't tested it. And I think it would look really strange to have like little like dots, right, on the face
Yeah.
versus hyperpigmentation, which is easy to treat. I think as a skin of color dermatologist, I'm not afraid of hyperpigmentation anymore because almost all of my patients are darker skinned. I live in San Diego, so I have a lot of techniques to help prevent hyperpigmentation or to treat it once it happens, but we have very little to treat hypopigmentation. And so that's more my worry.
Yeah, I agree with you. I think it's a lot easier to remove things from the skin than put things
Mhm.
back. So, like when we think about stretch marks, it's loss of elasticity.
Right.
That's a lot harder to treat than a brown spot that we could fade. But like a white area where there's no pigment is a lot scarier for us because we just are
Yeah.
praying it comes back, and the body does its magic.
Right.
So,
And I think it does for most patients, but is that a risk we want to take on the face? I not yet.
especially with a procedure that's causing a pattern on the face, because it would be really evident when you're talking to other people. So at the end of the day, we always ask ourselves, like, why are people doing these procedures? And it's really, we want to connect more with others. And if we're doing anything to prevent people from connecting better with others, we're doing them a disservice.
Yeah, I
Um,
think that's a great way of why we do cosmetic treatments, right? I think that's a really
yeah,
beautiful way of saying it.
it's true when you think about it. Okay, so can you walk through the procedure because it's a little more heavy duty than I think a lot of people understand,
Yes.
but yet it's not a facelift, right? So
Correct. So after having done so many cases, I actually feel that Ellacor is a lot less cumbersome than doing hardcore laser resurfacing, which is what we used to do before Ellacor for skin tightening. So it's much less recovery, much less downtime, and much fewer risks than hardcore laser resurfacing. The first thing is numbing. So how painful is this procedure? So we have three ways of numbing the patient for Ellacor. One is just topical numbing. You come in, we apply a cream to your full or to the lower face, and you leave it on for about an hour and a half. Then we have to go in and do nerve blocks, which are like the blocks that even dentists will do to numb a local area. So we do nerve blocks. Once the nerve blocks are set in, we then have to do lidocaine injections, which are little injections into the skin that kind of help numb that entire lower face and whatever treatment area we're doing, whether it's the lower face, around the mouth, or a little bit on the neck. Once the patient is completely numb, then the treatment is not painful because there's lidocaine underneath the skin. And as you were mentioning, it creates a pattern. So it's basically like a square-shaped grid with hollow needles, and it's attached to a vacuum. So we stretch the skin tight. The skin kind of gets suctioned onto the vacuum. And then when we press the pedal, the device will kind of inject the needles and pull them out rapidly to then remove the cores of tissue. So it's basically like needles are injected and then a vacuum suctions out cores of tissue. It sounds a lot more violent than it really is. I think lasers are a little more aggressive. Once a treatment is done, patients have like a bruise-like pattern or bruises in a grid-like pattern, kind of looking like, I call it like a beard. It looks like a beard or, a goatee or whatever we end up treating because it's kind of in that area. The first few days, it's very bruise-like, but by day 4, day 5, that has gone down substantially. And by day 7, patients are a lot less red. The main thing I've seen, though, is that patients get this residual redness, and that redness can last upwards of 3 months or longer. It has always gone away. I've never had any patient where it's been permanent redness or permanent discoloration. But that is the one thing that we've noticed. And if I see that, then we'll start using certain lasers that target the redness. And sometimes I'll do like a Fraxel treatment, which is a resurfacing laser, just to kind of help shed some of that iron staining that we think is causing the redness. So
do you think, sorry, I didn't mean to cut you off.
Yeah,
I'm just wondering, there's some thought that this inflammation that's going on after the procedure, we might want some of that it might be doing something at a cellular level to help regenerative processes that we're not necessarily aware of. What are your thoughts on that?
So probably, I mean, anytime we have scarring, we want to see what kind of inflammatory process is caused. I mean, I'm going to call it scarring, even though Ellacor is technically scarless, meaning we don't see visible scarring. As it tightens, it's still producing collagen to tighten. And when it's producing that collagen, we always want to make sure that whatever inflammatory process is happening is producing the right kind of collagen, which in the case we want is type 1 collagen. If we have inflammatory processes going in the other direction and it's causing a scar-like collagen, which is type 3, we don't want that. I think the reason we get redness from Ellacor is because when we're removing the cores of skin, there's blood getting stuck in between in those cores, and it's releasing iron. So it's almost like a hemosiderin deposition versus a true post-inflammatory redness. There's also no heat from Ellacor at all. And so when we don't have heat, one, it causes a lot less inflammation. So, there is something about having heat that we, tend to have with laser resurfacing. That heat is useful for collagen regeneration, but that heat also causes residual redness. So that's what causes a post-inflammatory erythema with lasers. And so we don't have that in Ellacor. So we're thinking that it's a hemosiderin deposition. The weird thing about Ellacor is that let's say I did treatment on day 1 and they had redness. Then if I do a treatment 4 weeks after the first one, the redness goes away. And so and we think it's because when we're doing the second treatment, it's removing the iron out. And so maybe helping with the redness. But we're still, still in the early process. So we are all in a Alacor chat group, and we all kind of chat about what we can do to kind of improve the outcomes and reduce the redness, which I think is the biggest issue with Alacor.
Right. And I mean, for those of you listening, wondering what hemosiderin is, basically our blood has iron in it. So it's basically the iron molecules in the blood. And that's why, like, sometimes on the bottom of someone's legs, when they don't have good blood flow, the blood vessels get leaky and can stain the skin a little brown. That's what we're talking about when we say the words hemosiderin. And my understanding is that's why you're doing the injections of the lidocaine with epinephrine before the procedure, as opposed to just putting someone out, because you want to kind of constrict those blood vessels so they're not as leaky during the procedure.
Exactly. Yeah. And then patients who are on blood thinners, which we have a lot of our patients who want Alacor also are on blood thinners, which I don't take them off because their blood thinners are important for their underlying systemic condition. But those patients do have a higher risk of that iron staining because they tend to have more bleeding. So
Really
things like arnica might be helpful. We just haven't studied it yet, in Alacor with Alacor. But things that decrease bruising might be helpful for decreasing that iron staining down the line. But it's not permanent, so it goes away. It's just a nuisance for a few months.
That's great. Yeah, like maybe arnica, bromelain, and K2, but if they're on Coumadin, they're not going to be wanting to take K2. We don't want to do that. So
no.
Don't do that.
Yeah.
Okay, so you're mentioning this beard area. So does that mean you can't treat the forehead or eye bags? Because those are common. Eye bags is probably the most common question I get from people.
Actually, yeah, me too. No, you cannot. So it's not FDA approved for the upper face. Now, I'm sure there are some providers who do probably do the upper face. The reason I don't do the upper face right now is because we have a lot of important blood vessels and on the upper face that are much more superficial. So and those blood vessels are running with nerves that kind of run alongside, right? Especially like on top of our eyebrow and then our temples as well. And so I don't want to disrupt those vascular bundles or those important structures. So I'm not doing anything on the upper face. I mainly target the lower face. I also am very lucky. I work in a practice where we have so many devices. And so if somebody has, concerns about other parts, I can just use a safer or an option that I'm more comfortable with. I think there are some providers who are going off label and they are doing other parts of the face. I would never do it around the eyelids. I think that bruising would be so severe. Plus, Alacor, when we're doing the treatment, it's a pretty deep treatment. So we're removing tissue from either 1 millimeter all the way to 4 millimeters deep. So that is incredibly deep. I would never do that around around the eyes. Or the temples or the eyebrows. Those areas would be off limits. Even if people do more superficial, let's say you do like 1 millimeter, like we'll do radio frequency with microneedling, for example, and that could be 1 millimeter deep. The important thing is that those things are just creating little punctures. It's not removing skin. Alacor is removing skin. So what if you remove important parts of the nerve or vessel? It would take the body much longer to regenerate that. So that's why I would never, until somebody does it and tells me it's perfectly safe, I am not going to experiment on the upper part of the face.
Yeah, I agree with you 100%. That's the one thing I love about this company. So for those of you who are listening, we're talking about Ellacor, which is ELLACOR, is the company is only putting this device in the hands of people who are properly trained, which we don't see that with a lot of devices out there. So even though you might believe that if someone is doing a procedure, if they're doing Botox or a filler or a laser, they're qualified to do that. Unfortunately, that's not necessarily the case. So when you're dealing with your body, you have to do your due diligence and see what kind of training the person has and make sure that they're going to do the right treatment for you. And with that being said, when you go to a center like UCSD or a center that has a lot of devices, they're going to choose the right tool for you. So it might be Ellacor for the lower face and then radio frequency with microneedling in the upper face and then something else for your neck. Whereas if you go to one place, they're going to be hitting everything with a hammer if they have only one device, right? So go to someone that has many options that's going to have your best interest at heart. And I love that you clarified the difference between microneedling and then microneedling with radio frequency and then obviously Ellacor. So microneedling is just making like go ahead.
Like little punctures in the skin. It's just like sticking a needle and just going, and that's it. And then microneedling with radiofrequency, we're creating a puncture and delivering heat at that depth. So if we have a 1 millimeter microneedling device and we're creating a puncture at 1 millimeter depth, we're then delivering heat if it's with radiofrequency. And then Alacor is actually just removing that entire skin from that depth without leaving any heat. So we have to, obviously that's beneficial in some areas where we want to remove excessive skin, like the lower face, but not beneficial where we have important structures. So we have to just be careful where we use it.
I love that. And then as the skin heals, it tightens up. So how many treatments should somebody expect to be getting?
Yeah, I usually say for most patients, it at least do 2 treatments. And I like to space them about a month apart if possible, just that, like I said before, we can remove that hemosiderin deposition or the iron deposition if it happens. If occasionally, if patients have severe wrinkles, they might need a 3rd treatment. But if I feel like they have really severe wrinkles, then they might benefit from a facelift and an Alacor treatment, because those are still 2 different things. If you have a lot of skin laxity, like what we talked about with weight loss, Alacor would be helpful, but the best thing would obviously be a facelift and then Alacor for things around the mouth or skin textural changes on the chin. But most people who are doing Alacor are not ready for a facelift yet. And so that's why Alacor is that in-between treatment before people want a facelift.
And much lower risks, obviously.
Much lower risk, yeah. We're not dissecting anything. We're not injuring any nerves. We're just removing excessive skin.
Have there been any studies looking at certain nutritional behaviors and results?
I feel like that would be a great topic for you to teach me about, because we haven't studied it from the Alacor standpoint, but when it comes to Sculptra or using tightening devices that use heat, so Sculptra is the type of filler that helps to create collagen. Patients who are on a high protein diet are going to make more collagen from these collagen producing treatments. And of course, we know that a high protein diet will also be more helpful for healing. So when we've done studies on surgical patients on a high protein diet will heal better and faster than patients who are not on a high protein diet. But because you have a background in nutrition, I would love for you to tell me what you have experienced or what you see.
Yeah, I mean, there's so much we don't know. I have a hard time saying facts when there's not science behind it. And we all know nutrition is one of the hardest things to study. But I do know it plays a role. And even with, PRP and PRF, I believe that the results people get with, PRP injected or PRF for hair loss does improve the results depending on your diet afterwards, if it takes or not. So yeah, I'm just curious. Okay, so anything else we need to say about Alacor before we step into the next?
No, I mean, I think I've covered it. Can't think of anything. I do have a YouTube video on it too if people want to look at the photos of the recovery, because I think that is much harder to describe. It's easier to see in photos, but yeah,
it's a little scary, but from what I hear, it doesn't hurt as much as it looks. Like it hurts.
It doesn't hurt as much as it looks. I really think laser resurfacing is much more aggressive and more painful in the recovery period. Alacor doesn't hurt after the procedure is done.
Yeah. Okay. I'm going to be getting it sometime in the next couple of years. So yeah, I'm
ready.
A little bit...
I'm ready for you.
I know. Yeah. It's so hard to go to San Diego. It'll be such a hard place to go to.
Well, you love the sun and you won't be able to see the sun. I think that's the main thing maybe I should mention is that during that 1 week recovery period, just like any treatment, you just cannot look at the sun. You have to not only practice sun protection, you have to practice sun avoidance. So,
well, you could wear one of those balaclava masks. I've worn those outside.
Yeah, as long as you don't expect to look sexy afterwards, I think we're good.
No. I always say it's better to compromise the way you look 1 hour during a hike than the rest of the 23 hours. So yes. Okay, next. So after Alacor, not saying that Alacor is your number one, but it is one of your top procedures. Mm-hmm. What is the next thing that you're super excited about in 2024?
The other, we were just talking about under eye circles and bags and how people always complain about that. So I think that's one of my biggest complaints. And one of my favorite ways of treating it is by using platelet-rich fibrin, which we also just briefly mentioned. So platelet-rich fibrin is similar to PRP or platelet-rich plasma, which is where we, take your blood, we spin it down, and we take these growth factors and we kind of inject it in the area we want response. So when it comes to under eye hollows or some shadows around the mouth or shadows along the chin, instead of just using hyaluronic acid filler, which is what we used to do, which caused a lot more puffiness and fluid retention, we can now use collagen stimulating treatments like PRF, which is what I really enjoy doing, and I get really great results from it. It's a series of treatments, and so we have to see patients like every month, and we do about 3 to 4 PRF treatments, and the results are much more subtle, I would say, than doing like hyaluronic acid filler treatments. But the results they last longer, I think, in younger patients than in older patients. And most people do need maintenance treatments, but they are much more natural looking because we're not completely eliminating that junction between the cheek and the eye. We're just softening it up so that it looks much more natural and it moves a lot nicer when patients smile without causing that bulge that we can see sometimes with hyaluronic acid filler.
Right. Yeah. So for people that have sunken in areas under their eyes, I would say like 10 or 15 years ago, we were doing hyaluronic acid under the eyes. And some people are still doing that.
Mm-hmm.
And I actually have a story. This was back in 2009. And I was at an ENT doctor in Hawaii. And I said, "Do you ever do hyaluronic acid under the eyes?" I should have known. He goes, "No, but I can try."
Oh
He
no.
injected it under my eyes, and I guarantee up to 2015, if you saw me stand across the room, you can still see bags under the eyes because I feel like these molecules, they migrate and gravity pulls them down. And then it almost looks like instead of filling the hollows over time, they kind of migrate and they sometimes come to the surface too, maybe from smiling, we're pushing them out. And I just have never been happy with the way they look. When I was in a cosmetic practice, I'd always send them to my partner because she loved it, but I did not. I wouldn't do it. So I love the fact that there's PRF now to help with the hollows under the eyes because it's your own body. You're drawing your blood, you're spinning it down and centrifuging it. You're taking the platelet-rich fibrin
Correct.
instead of the platelet-rich
So yeah, the
plasma.
platelet-rich plasma. Yeah, the difference. So there are people who do PRP injections under the eyes. I think PRF works better. It's very similar to PRP, but the way we make PRF is different. So plasma is more liquidy, and when we make PRP, those tubes that we draw the blood in, they have anticoagulant, meaning it doesn't clot the blood. So that way it stays liquid, and we can use it and inject it much more easily. The PRF tubes don't have an anticoagulant. So meaning that once we make that platelet-rich fibrin is technically a clot. And so we take out, and that clot they have a lot of growth factors. So we're literally taking out a fibrin clot before it starts clotting. But once it's more jelly-like, and then I inject it under the eyes, what then happens is that it clots right under the eyes where I've injected. And I don't want people to get scared. It's not like a blood clot. I'm not injected into blood vessels, but I'm injecting this fibrin matrix under the eyes. And it becomes a little bit more solidified. It stays there for about 3 to 5 days, and it slowly releases these growth factors over 3 to 5 days versus PRP, which releases growth factors within 3 to 4 hours. And so when we have a slower release of growth factors, we're going to have an increased collagen stimulatory capability. I don't inject PRF for the hair, and that's because I'm afraid that you can have the opposite, where when you inject PRF and it kind of clots in that area, then you can have congestion of the hair follicle, which can then cause hair loss, theoretically. So I do PRP for hair loss, but I do PRF as filler because of the fibrin clot, the matrix, and how long it stays under the skin once it's injected.
That's really great. That's a great explanation. Okay, so it's a thicker matrix, so it kind of fills in that hollow a little bit better. Or if somebody has like eye bags, how do you technically make that visually look better without, because surgically we're not removing the bag.
We're not removing it.
So you're doing the procedure to make it appear like the bags aren't there when people look at you.
Same concept as a filler, right? When we inject normal filler into the hollow, whether the hollowness is caused by bony loss or whether the hollowness is caused by the the bags, the eye bags, which are the fat pads that have dropped. We're still kind of using it to camouflage. So we're doing the same thing with PRF. I will sometimes combine PRF with like other modalities, like, the microneedling with radio frequency. So I can help tighten that skin better. I can maybe help, if we can tighten that skin better, it will help camouflage those under eye bags better. Or I will combine it with something called Tixel. Tixel is a device that's not technically a laser, but it releases heat in like a grid-like pattern. And so it's not injuring the skin, it's not removing any skin, it's not puncturing the skin. It's simply just it's these titanium needles that when they touch the skin, it delivers heat. And it delivers the heat in like a fraction of a second. And so we can control how much heat is being delivered. And so I will sometimes combine that with PRF, which is a very simple, low downtime treatment. The thing about PRF that we have to discuss, I think, so once you inject it, it's full. You're like, oh my gosh, it looks so great, it's full. But then the fullness goes away. And then we inject it again, the fullness goes away. So it takes a few months after the treatments are completed to then get that collagen production to help fill that hollowness. And it can last about 6 to 9 months. I think for younger patients, it lasts a lot longer because they are breaking down collagen at a slower rate. And then the older patients, they might need maintenance treatments, once a year or once every, 9 months. I actually have a similar filler story that you do for the under eye filler. I was a surgical fellow at UCSD like 7 years ago, and a resident wanted to learn how to do filler. And I had these like, I'm Indian. And so we have these like under the eye circles and these hollowness, and I hated them. And she filled them. And then I like rubbed my eyes because they were so itchy, and the filler migrated down, and I had these like 2 puffy things of filler for like 3 years. That I finally dissolved it, and I've done other things to help with my under eyes. But yeah, I have the same filler story. So while I do inject hyaluronic acid filler for tear troughs, what I will do sometimes for patients who don't want surgery but they still want to help improve is I'll do a series of PRF sessions first. I will improve the quality of their skin. So right when we increase collagen, we're going to thicken that skin, and then that's going to hold that filler a lot better than if we don't improve their skin quality.
Right.
Prior.
Yeah. And that's kind of what we're saying. It's not like there's one thing for everyone. And we're not saying that all hyaluronic acid is bad, but like you have to really get the bespoke treatment plan for yourself that's going to work. And there's a lot of treatments out there. And I think also we don't necessarily need an entire syringe of hyaluronic acid. Like less is more, because it does tend to move and migrate. And you can reverse it if you're someone who doesn't like the placement of a filler, or if it has moved, which I think with ultrasound studies are seeing a lot of these fillers move into planes that we don't think they're in. Then you can have the filler dissolved. If it's a hyaluronic acid based filler, it could be dissolved with an enzyme called hyaluronidase, which can help it sort of melt apart.
Yeah, the MRI studies like found that filler was in a different plane, so in a different tissue plane, even 15 years after injection. And when I've done skin cancer surgeries on the lips or around the eyes, I actually see it underneath the microscope. And the patient even forgot that they had filler done. They're like, I've never had filler done. And I'm like, are you sure? Because I can see it. Like underneath the microscope. And they're like, oh yeah, but that was 20 years ago. It's long gone. But we know now that it doesn't truly go away. It just it loses its benefit. Like it's not in the place we want it to be, but it's still in the face. It's just in a different tissue plane, which can then, sometimes it does nothing. But over time, if we keep on pumping filler and the filler is just going to a different tissue plane, that's when we get the balloon, like the overfilled syndrome, right? Which is, I think there's certain celebrities like Courtney Cox from Friends, Monica Geller. She had like filler done and she was starting to balloon up, and then she got it all dissolved.
Yeah.
And that was just because too much filler was placed over time.
Right.
Yeah.
I know. I mean, it's such a process. Like we think we know so much, we think we're doing everything right. And then in retrospect, we reassess and we just keep going back to balance. Like we keep wanting to go back to balance, like what looks the most balanced, and we have so many more things nowadays. When I trained, we had no fillers. We had collagen. That was about it. So, I mean, we've come a really long way. Okay. So with PRF, so under the eyes is a great spot. Where else can you do PRF?
Yeah. So we can make PRF, and then there's a slightly different way of making PRF for the rest of the face, or I make it a little bit differently for the rest of the face. I want to make it a little bit more thicker. So we I'm going to try to
Well,
simplify
let's get
this,
this
but
clear. Really, I'm making
yes.
it and you're taking it from my body. Just kidding.
I know you are making it.
Or whoever's, no, we're
You're like,
just
it's
teasing.
my growth factors.
Well, because,
Uh,
I'm sorry, everyone, because we're drawing blood. So we're drawing
yes.
the person's blood. So you're making
Yes.
your own PRF.
Yes, you're making it, but I'm going to take it and I process it. And we process it a little bit differently for the face to make it thicker. And so I can inject it anywhere on the face, which is so nice. I can inject it just like filler. I can inject it in, these what we call the nasolabial folds. I inject it into the cheeks, the temples, the marionette lines, which are these shadows here. I can even inject it into the lips to help with like the kind of help define that lip border better. I actually combine PRF with certain like Sculptra, which is that collagen stimulating filler, or I will combine it with Radiesse, which is another biostimulatory filler. Like if I'm filling the chest or the neck, I will actually combine it with those because I want not only the regenerative capabilities of PRF, but I want the healing capabilities because it helps speed up healing because there's so many growth factors, right? When we think about the healing process, if we have a cut on the skin, it's the fibrin matrix, which then creates the scaffold for healing of the body to occur. So very similarly, we're trying to use those capabilities for, other parts of the body. I even use it after I do Alacor. I'll take PRP or PRF and inject it to help with healing with lasers. I use it in a lot of different ways. We can, when it comes to PRF. But yes, to answer your question in a very long-winded way, we can use it on other parts of the face and neck. It's not useful, for example, I can't inject PRF into the stomach and tighten it up, right? So it's mainly it's for thinner skin.
Okay. That's really fascinating. I didn't even know that you were doing all that. And then as far as when people can see results, it's sort of like you mentioned with the eyes. So if
Mhm.
you're doing it in the face, they'll see an immediate result and then
Correct.
it will fade and then slowly build over what, the next 3 months or so?
Exactly. So they'll see an immediate result because there's volumization happening just from injecting liquid. Within 3 days, that the water goes away. And then I do a series of treatments, but I usually say by the second treatment, you'll be like, oh yeah, I see some softening. And then it takes about 2 months after the third treatment to start noticing that collagen production. The thing we have to remember though about these collagen producing treatments is that results are variable. Some people
Mhm.
just naturally make more collagen than others. And and right now, I don't have any way of predicting who's going to make more collagen compared to another person.
Right. And we're also
So,
aging at the time that we're
mhm,
expecting results as well. So there's so
exactly.
many variables, but I love procedures like that because I always think like, okay, if you look at yourself today and then you look at yourself in 2 years, like you're slowly reverse aging so
Hmm.
slowly that nobody can figure it out. And you never get the, what did you do? You just,
Exactly.
all of it, you just slowly look better that people you
Yeah.
haven't seen in a few years will say like, oh, wow, you look really good.
Yeah, like and that's the goal. Like we shouldn't all look like Kim Kardashian after one visit to a cosmetic doctor. It looks bad. I also like to under promise and over deliver. So anyone who ever wants to do PRF, I'm like, listen, it's going to be so subtle, like very subtle results. And if you get more than subtle improvement, I'm really happy for you. But the whole point of all of this is, doing what's called collagen banking. We just want to, since we're losing collagen, we want to bank our collagen. We want to have more and more and more collagen in a healthy way where we continue to kind of, like you said, slowly age backwards or keep where we are.
Yeah, I mean, and sometimes it's not sexy to just like make sure your foundation of your house is really strong, but that's really what
Right.
we're focusing on here because you
Exactly.
start decorating the upstairs and the foundation falls apart, and who cares about what, the upstairs looks
Yeah.
like. So,
Yeah. That's a great analogy.
okay, so where do would exosomes to come into play with all of this? So, like you hear a lot about exosomes and stem cells and PRP
Hmm.
and PRF, and I feel like you did a really good job explaining the difference between PRP and PRF and them sending signals to help kind of boost cell growth
Right.
and renewal. But like, how does that compare to stem cells, which we can't use in the US, and then exosomes?
Correct. So the nice thing about PRP and PRF is that they're autologous treatments, meaning that they come from your own body. Therefore, when it comes to FDA regulation, it's a lot less stringent, but it's also a lot safer because you're making it, I'm just taking it and putting it into an area where I think you need it. Exosomes are coming from somewhere else, right? So they're coming from other stem cells. They're not coming from your own body stem cells. So they're what we call allogenic. Hopefully I pronounced that right, but they're not coming from you. So exosomes are, scientifically speaking, they're extracellular vesicles. So I call them like mailmen. They are like little, there's like a postal service, and they're delivering messages to other cells. So that's actually where extracellular vesicles or exosomes are. So exosomes are little envelopes, and they contain, peptides or proteins or what we call nucleic acids, which are the building blocks of DNA. And one cell will send this exosome to another cell to communicate, hey, I want you to do this. And so when we get exosomes for a cosmetic practice, we're getting them from stem cells, but we're not able to control what's inside that exosome. Like, what is that mailman actually carrying? We don't know. So when they're processed and they're put into tiny little cute glass bottles, and we call them exosomes, it's not regulated what's inside those exosomes. It's not regulated what the exosomes carry. So we're like, okay, well, exosomes carry all of these communication materials that cells use, and we have some studies to show that it does help with like collagen regeneration. It can help with, also improving healing outcomes, but we don't have enough research yet. It's also not FDA approved, right? So that's where it becomes much more complex when we're trying to give it to patients. Now they're not ingesting it, so they're using it topically. However, because it's not FDA approved, the counseling is a lot different when it comes to patients, because we want to make sure that there's no harm done from using exosomes in practice. So I'll be honest, I personally have not used exosomes at UCSD because it's not FDA approved. And, we're in an academic center, so we're much more careful about what we're using for our cosmetic patients. I would want more research. I think one of the things that I'm also worried about with exosomes is that they're coming from stem cells, and stem cells like to grow. So the job of a stem cell is to grow and create more cells, that either stem cells or cells that we want them to become. And so a lot of these vesicles from stem cells are going to contain messengers that cause cell proliferation. They want cells to grow.
Growth.
Yeah. Cell growth. So then does that create an oncogenic potential? So does that theoretically increase risk of maybe skin cancers? We don't know. We don't have enough research. I think I'm a skin cancer surgeon as well, so I think that's like the first thought I have when it comes to using exosomes. So we don't know, and probably the risk is very low. I think we had the same thought about PRP and PRF, which contain growth factors, and we now have studies to show that PRP and PRF do not increase they don't have an oncogenic potential. It's so probably the same with exosomes, but I just feel like we don't have enough research to show how effective they are. However, I also don't think that while I talk about these theoretical risks, I don't think that in practice, they're probably not that harmful.
Right. It's sort of like what you were saying about the high protein. Like, we need high protein so that we have the amino acids to build collagen, right? But high protein diets also promote mTOR, and mTOR can promote cancer. But,
right.
So then you want to cycle, we want to cycle everything. We want to be in phases of growth. We want to be in phases of cell breakdown and regeneration and things like that, whether it's our whole body as a system or even during the healing process. We need to form a time where we clean up, and then a time where we build, and then a time to clean up and a time to build. And I think that's why, just going back to this whole discussion, nothing is all good and nothing is all bad. Like, there's a time and a place for everything. I have a lot of friends who use exosomes, and some of them swear by it. They say they know that if they put exosomes on one side of the face after laser or after microneedling, it heals so much faster. They are kind of expensive. So you have to keep this in mind. Also, like, where your dollars are going and what's going to be the most cost-effective way to spend your dollars. So I don't know. I mean, I'm excited about them, but it's in the TBD kind of category for me as well. And I think the most fascinating thing that you said that I have never heard before, and I've been hearing about exosomes since 2016, is the fact that you don't know what the message is going to be, right?
Yeah.
I'd never thought
can't
about
control
that.
it. Yeah, we just get them from stem cells, but we can't look inside the vesicle and be like, hey, what's in there? Do you have DNA material? Do you have protein? What's in there? Like, what are you going to do if I put it on something? So that's why I think like the response is hard to also predict because it's not like every little glass bottle has the same product of exosomes.
Yeah, when they were extracted,
Right.
what was happening in the body of that person was when it was extracted. The other thing that's always been in the back of my mind, because I have used exosomes from two different companies, and you get a big report from the company saying it was checked for all sorts of different diseases
Hmm.
because these are extracted from usually from like umbilical cord, right?
I think so. There's like a myeloid lineage, and I can't even explain right now what myeloid is. But there's two different
Bone
stem
marrow.
cell yeah, I think bone marrow, that's right. But there's like two different, I don't know why I just had a balloon emoji
I
go up
know.
on
I get the
my
thumbs
Zoom.
up all the
I
time.
don't know. Okay. But there's two different lineages of where they come from. And I don't remember exactly like where they come from, but it comes from people. I don't think unless they have figured out to grow it in a cell plate, which I don't think that they have yet.
No, they get them from people, and they're usually young people. So,
Right.
unlike PRP and PRF, which come from yourself, and when you need it, you're usually over 50, the health of your own stem cells is not as good when you're 50 as it
Hmm.
is when you're 20. So, that's one of the arguments why exosomes might enhance the treatment benefits.
Hmm.
But what I was going back to is you get a whole report about all the diseases that these things were checked for, but how many diseases don't we know about?
I think that all the time. I mean, how many things don't we know? We don't know
There,
so many
we
things.
know, I feel like we know like less than 1%.
I
So
agree.
it's a pure, I don't know. I mean, yeah, you can get that walking down the street. Who knows? But
Right.
it's just it's all about risk and benefits, and going back to what you said about Ellacor, like we're here to benefit. We want to minimize the risk when it comes to aesthetic procedures. We want someone to get the best benefit and have the least amount of risk possible, because it's really just there's no room for, you know.
Yeah, and these are elective treatments. They're not medically necessary procedures. So that's even more of a reason to like learn about the risk profile, and make sure. I think exosomes also sound really sexy, like exosomes, stem cells, regenerative medicine. I also love talking about all of that and longevity, and that's all up my alley. But I think we have to kind of take a step back sometimes and like, well, what exactly, like what harm can be done because I'm using it for a cosmetic purpose, not to treat a medical illness.
Hmm. Now there's some skincare with exosomes too. Have you played
Mhm.
around with any of that?
I had a rep come to the office to discuss it with me. I haven't played around with it too much. I think when it comes to skincare with exosomes, how much of the exosomes are actually being absorbed? I think probably zero.
How
Exosomes
does
are they're large vesicles. I think they're between 30 to 150 nanometers in size. And so I don't know how to, I mean, it's small in the grand scheme of things, but not all of them are going to absorb through the skin barrier. So I think again, it sounds really sexy, but are they actually being absorbed through the skin barrier? If it's just a topical application, I doubt much would be absorbed.
Right, unless your skin's compromised. I know that was my
Hmm.
thought too, because I tried one and I liked it, but is it the carrier vehicle that I like, or is it the
Yes.
product? Like, who knows, you know? So to be determined on that one. Okay.
Yeah. There was actually, I was looking at some exosome studies. I did a journal club with some residents in the beginning of this month. And um, it's funny because they were looking at exosomes with hair loss. And the way they studied the exosome was they did one side where they just like, where I believe they like applied a placebo, but then they did the other side where they did microneedling with exosomes or microrolling with exosomes, and they saw an improvement. But that's how the exosome studies are. Like they're such poorly designed studies. And the reason that study was poorly designed is because you can massage the skin with microneedling and get improvement in your hair loss. So how much of that outcome was exosome related and how much was it related to just the improvement in blood flow from the microneedling device used? And so I think
Right.
we just need much better studies that really have placebo controlled studies to be able to study the efficacy of exosomes.
Yeah, yeah, that's great. Okay. You ready for the third?
Sure.
Okay. What is your third excited procedure?
So actually, I haven't done much of it yet, but we just got a new treatment for hyperhidrosis. So hyperhidrosis is when you have excessive sweating, and people can have it on the underarms or like under the boobs or hands, feet, or you can have more generalized hyperhidrosis. But the most common is, in the armpits. And so it's called a Brella patch. So like the Rihanna song, like umbrella, but just Brella. And
You know
it's
all the
really
celebrity gossip. I don't know any of
I
this.
only know the songs from like 2000. But it's called a Brella patch, and it's a really cool treatment. So I think just to kind of go back, usually for excessive sweating, we have to give antiperspirants or aluminum-based deodorants, or give them medications that are what we call anticholinergic medications, which have other side effects to help reduce their sweating, or Botox injections, which are super painful, or Miradrag, which is super painful. So in contrast to all of that, Brella patch is like a 3-minute treatment. It's literally a patch. The patch contains sodium ions, so just like salt, like half of salt, basically. And it's when the sodium ions interact with the sweat, which is water, and the sweat also contains, salt. But when it interacts with the water within the sweat ducts, it creates a tiny little thermal injury to kind of obliterate that sweat duct, or to help calm it down. And so it's literally, so it's it's a complicated kind of mechanism of action, but in a way it's also really cool because we're not injecting, we're not giving you anything that is not already what your body already makes. So this one has sodium ions. It's a 3-minute per armpit. So we put a patch on, we take it off after 3 minutes. We put another patch on, we take it off after 3 minutes. The results take about a week. So it'll take about a week for you to notice, and they can last for about 3 months. It doesn't completely eliminate sweating because we need to sweat, but it just helps reduce it so that it's much more manageable. It's right now, we're using it for patients who have moderate hyperhidrosis. So not somebody who has severe hyperhidrosis, or someone who's moderate. The reason we're not using it for the horrible sweaters is because when we create thermal injury, we can have a risk of a burn. So tiny little erosions or burns in the area. So we don't want to take that risk yet. So we're just doing it right now for the moderate hyperhidrosis patients and just seeing how it works for them. And I thought it's a really cool new treatment, cool new technology, and could potentially be life-changing for a lot of patients. So
Yeah,
I'm excited how it
that sounds
works.
super excited. I think
Yeah.
that's great. So are you able to do it on hands?
And I haven't tried it yet. So right now it's just approved for armpits.
Okay.
But I
'Cause
might try other areas like under the boob, or, I haven't tried it. I feel like with hands, those are so sweaty that I would be scared of causing little erosions, which would then take a long time to heal. And we use our hands a lot. But I think it was kind of TBD for that.
Right. Yeah, I don't feel like we have satisfactory treatments for the hands. Like
I don't.
I can do Botox under the arms like really well, and it's not painful if you somebody with
True.
numbing cream beforehand, but it can be pretty pricey. So where does this run in cost compared to
Yeah.
Botox?
I don't know how much you guys charge for Botox, but usually you have to use a lot of units, right? So it can be upwards of like
Uh-huh.
$500 to $800, sometimes 1,000, depending on where you're going. So the Brella patch is anywhere from 350 to 600, depending on where you are in the country. So
Every 3 months. That can be a game
every three
changer
to
for.
four months.
Yeah. So I used to work at the US Capitol in Washington, D.C. And, there's certain jobs like politicians or
Hmm.
salespeople that you can't be sweating under your arms. So we need to have options out there. So besides just topical options, which can be really cumbersome and really stressful because it can work consistently for a few days and then not work when you're in
Right.
that important meeting. Then we have
Yeah.
Botox, which can last about 6 months. And I do 100 units, so 50 units per
Hmm.
axilla.
Yeah,
And
same.
yeah, so we're talking like $1,200 basically it ends up costing. And it lasts about 6 months. It takes a couple weeks to kick in. Now we have Brella, which you're seeing really good results for. And as you're talking about it being for moderate, I'm kind of wondering down the road if there's maybe like a combination approach where you can do
Probably.
Botox to knock them down to be more mild and then do Brella and me and my fingers.
I was like, what? It's like telling you, good job, Jen. Keep going.
For those of you on YouTube, basically I talk with my hands and we're getting thumbs up on the Zoom here. So Brella is another option for focal hyperhidrosis under the arms. Are you seeing extra sweating on the back like we typically do if somebody is not sweating as much under their arms?
Extra sweating on the back?
You know how you get like compensatory hyperhidrosis elsewhere? Often I'll see it like on their back.
Like on the back. I think so. We just got it. I don't have enough patient experience to be able to know if we're getting compensatory sweating or not.
Yeah.
I think since they're still going to sweat a little bit despite the Brella, I would assume maybe not as much compensatory sweating, but TBD.
Okay. Yeah, right. Okay.
Yeah.
Yeah. So for those of you that listen to the skin as a detox organ, and we talked about the importance of sweating. So this is just helping minimize how much you're sweating in the sensitive, embarrassing areas. And It's not preventing you from detoxifying. And it's a way to prevent aluminum, which came up in a lot of DMs that I got from people just because we have such a holistic audience of people that don't want to put aluminum chloride on their skin. So this is a great option, the Brella. So how do people find, if they're not in San Diego and they can't come to you for this treatment, is there a way that they can find out who's doing these treatments since it's such a new treatment?
It's a relatively new treatment. And so it's not in all the states yet, but if you go onto the website, I think if you Google Brella and you go onto their website, they should have a list of providers who offer it.
Okay. We'll have a link in the show notes. Okay, great. Anything else?
No, I feel like we had a really great discussion. It was really fun.
It was. And I'm so glad you're on the cutting edge of these things. I love that so much. And can you just share your YouTube channel? We'll put it in the show notes, but I feel like your YouTube channel is so good. I like your visuals and I feel like you explain things really well to people. So share that with us and how people can find you.
Yeah. So my YouTube channel is at Dr. Swati Kannan, and same on Instagram, same on TikTok. And so people are welcome to find me on there.
Okay, I'll have that in the show notes. I didn't know about the TikTok. Okay, great.
I mean, I'm not active on TikTok and I don't do any dances.
Yeah.
So it's just me talking.
That's exactly how it should be. So it's so funny. One of the things I miss about San Diego is you're up on your famous people, on your celebrities. Like as you're talking, I'm like, I don't even know what Kim Kardashian looks like. I don't know about Courtney Cox's filler face. I don't know about any of these people. I know.
Maybe I have too much time on my hands. I don't think that's just me in San Diego. That's just me flipping through my social media.
Oh, I do recall people would come in and they'd specifically pull out celebrities. Yeah. So it's fun. It's fun.
Yeah. No, I did have somebody who wanted like the Kim Kardashian. She looks great. Kim K actually looks really great, but I think a lot of people want to look like celebrities and I try to steer away from that. But
yes, we want you to bring out your own best assets.
Yes.
You know what's fascinating? My sister is a makeup artist. She lives in Milan and she's always sending me photos of the models before makeup. And they don't.
What a fun gig.
Yeah, but the point is that nobody looks like how we see them in the media. People look very different in the background. And we see that as dermatologists. We see the real people all the time. Mm-hmm. So when you're seeing someone in the media, don't think that they look like that all the time because it makes you be hard on yourself. And we don't want that. We want you to just embrace who you are and love who you are and be who your best self is.
Yeah. And that's really the goal of all of these treatments is to just be a better version of you.
Exactly. Well, thank you. Thank you, my dear friend.
Yeah.
Appreciate
thank you for having me. This was so fun. I will see you soon.
Okay. Yes. Bye.
Thank you. Bye.
If you're enjoying the Radiance Revealed podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, please give us a review, as that helps others to find this podcast. And if you want to connect with me, please visit my website, drjenhaley.com, or you can find me on Instagram at drjenhaley.
Hello, everyone. Just a friendly reminder that this podcast is for educational and informational purposes only. The statements and views expressed on this podcast are not medical advice. Opinions of guests are their own, and this podcast does not endorse or accept responsibility made for statements made by guests. Neither this podcast nor any of the information contained within it are a substitute for care by a qualified medical professional. This podcast is provided with the understanding that it does not constitute medical or professional advice or services. If you are looking for help in your journey, please seek out a qualified medical practitioner.